Hi, good morning. My name is Dr. Waqar. I'm working as cardiologist and a physician. I just want to tell you something about the fatty liver, which is getting more common nowadays. And whenever you go to the doctor asks you to do different investigations, tests, and including the ultrasonography of the abdomen. In the ultrasonography, you will find it out that one out of three patients are getting developing this fatty liver. What is fatty liver? It is actually the deposition of cholesterol and fats inside the liver. So it is very dangerous in the long term, and in the short term, it is dangerous like that. It has got no symptoms. Only few patients got the symptoms. What are the symptoms? There is some light heaviness on the in the abdomen on the left side, and some people feel nausea, and some people may have got some vomiting and bloated feeling. So it is important. What are the causes of this? There are two types. One is the alcoholic fatty liver disease, and one is the non-alcoholic fatty liver disease. So this, as the name implies, that alcoholic fatty liver disease is due to the alcohol consumption, excessive alcohol consumption, and the non-alcoholic fatty liver disease, NAFLD, is due to hepatitis B or C, or it may be due from the high cholesterol levels. But it also can happen in patients with having overweight or obesity or diabetes, and in addition to that, having high blood pressure as well. So it is important. This is a lifestyle disease, so you have to improve your lifestyle so to control the disease. What happens? There is a swelling of the hepatic cells, and sometimes this is simple benign. It cannot cause any problems. But NASH, non-alcoholic steatotic hepatitis, this type of fatty liver disease causes the inflammation of the cells initially, and then the swelling of the hepatocytes. These are cells of the liver, and then they are started off this fibrosis, small fibrosis, then leads to the scarring in that place. Later on, in 15 to 20 years time, it may be variable, but in some patients it stays it for such a long duration of time. It can leads to the scarring of the whole of the liver, and this will causes cirrhosis of liver, which is not treatable by the medicine or lifestyle changes. Then we need to transplant the liver. Liver transplantation nowadays is very easy, in which only small portion of the donor liver is transplanted, which can grow on itself along with the medicine, of course, no doubt. Instead of getting this such type of condition, it's better we should go for this initial diagnosis as soon as possible. Whenever you go to the doctors, ask them to advise you the ultrasound. I'm sure the doctor will also advise on itself their own. So whenever you go to you get the ultrasound, and you will find it out that you have got fatty liver or not. So if you got the fatty liver or not, you have got the tendency, like some people got the tendency that they have got they have got overweight, they are diabetic, they got blood pressure, they have got high lipid levels. So you need to control those. How you can control this? Do you need to reduce your pressure by medicines, by dietary restrictions, like to stop taking the excessive salts, and also regular exercise and walk. So walk is very much important in the diabetic patient, in the high blood pressure patient, as well as the patient with obesity. So if you have got high cholesterol levels, you need to reduce it with the diet as well as with the medicines. You need to stop the saturated fatty acids, in which are present in different type of these oils. So you have to take only sunflower oil, corn oil, and olive oil, which are good. Canola can also be used, but most of the oils contains high contents of saturated fats, so you should avoid those. So just go to the grocery shop, and whenever to go to buy the oils, you need to read all the contents that contains in that. And in addition to that, ghee is also not good for these fatty livers and cholesterol levels. What happens when your cholesterol levels are high? Slowly, gradually, the high blood cholesterol levels get deposited into the liver. So in 60 to 70% of patients with high cholesterol and high lipid levels develop the fatty livers. So this is very important. cholesterol, control the cholesterol, control your blood pressure, control your weight. For the weight reduction, you need to stop down your carbs. So simple and the complex carb. This will help on not only in controlling your diabetes, and it will also help in reducing your weight as well. So it is very much important to change your lifestyle so that you can avoid such a situation when you have to develop the advanced stages of the fatty livers. Thank you very much.